Hi guys! This video is about how you can know if you actually recovered enough of it after a training session. We all know by now that recovery is really important to avoid chronic overuse injuries like Achilles tendinopathy or tendinosis. But how do you know if you're actually getting enough recovery time in? My name is Marika. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries via video call. You can check out the link to our website in the description of this video. So I'm going to discuss 3 signs that's telling you you need to take more recovery time or recovery sessions in your training. So number 1, you're still sore from the previous session. This is the most obvious one, but it's amazing how many times people fall into the trap of doing a hard training session when they're still sore from the previous training session. That soreness is telling you that your muscles and your tendons and your body has just not fully recovered from your previous session. So remember, whenever you do exercise, you always get microtrauma. And that's normal, and we actually want that because that microtrauma stimulates the body to repair itself so that it's stronger the next time that you train. But if you don't give it enough time to recover that microtrauma, you're starting to add microtrauma on top of microtrauma, and eventually you get macrotrauma, which means it results in an injury. And Achilles tendinopathy or tendinosis is typically an overuse injury. So what can you do if you're still sore from a previous training session and you really want to train? Please don't do high intensity training or a hard session. Rather opt for an easy training session or cross train, so go swimming or cycling instead. Then, second sign that you're not recovered fully. Tight muscles that won't let up. I often get patients in the clinic who say that it doesn't matter how much they foam roll or stretch, their muscles are just remaining tight. What should they do? Well, the problem is, if the muscles are really overtired, you can stretch until kingdom comes. It's not going to relax because the muscles are overworked. And interestingly enough, I've had quite a few patients with Achilles tendinopathy where part of their history includes several weeks of having really tight calves. Now, there's no research out there that actually mentions that bit. That's just something that I've observed in clinic. So if you're finding that your muscles are really tight and they don't want to let up, then I would again add in more recovery time, cross train a bit more, do a bit more easy training like swimming or easy running rather than hard running sessions. And then lastly, number 3, if you're feeling constantly tired. So constant tiredness can be a sign of overtraining in general. And if you really push through that tiredness and you try to train on top of it, you can turn it into overtraining syndrome, where it can take months and months to recover, that you kind of get flu-like symptoms from it. Now, there are plenty of other reasons why you can be constantly tired. Stress, for instance, emotional and physical stress can cause you to feel tired the whole time. Interestingly enough, mental stress has also been linked to increased injury rate. Same goes for lack of sleeping. So lack of sleeping or quality sleep can again really make you feel tired. But again, that has also been shown to predispose athletes to injuries. So it's really important to make sure that you get enough sleep. And that's part of the solution for this. If you're feeling really tired all the time, try and identify why. Is it a combination of things? Are you trying to train really hard while you're really stressed at work? Maybe you should dial down the training a bit, that it's more of relaxation training than hard training. So there's a little bit of a table that you can use if you can read this properly. So you'll see on the top level, it's how do you feel mentally. On the side, it's about how do you feel physically. So if you're feeling rested, mental side, rested from a physical side, you can do a hard training session. If you're feeling moderately tired from a mental side, but quite fresh from a physical training side, you can do a hard training session, but you need to put a lot of self-care in there. If you're feeling really drained mentally, but you're still strong physically, again, you can do a harder session, but you're probably better off doing an easier session. If you're drained mentally and drained physically, then you need to really optimize self-care and maybe just take some time out. So have a look at that table, and before training session, really just take stock and see, how do you feel? Are you really up to a hard training session or a training session at all? Should you be rather doing something else that can help you? Excellent. If you have any questions, let me feel free to ask them in the comments, but you're also welcome to email me. And if you need any more help with an Achilles injury, you're welcome to check out the link to our website and have a look there, and let us know if we can help you. Take care.